Great senator from the great state of New Hampshire, Republican, and that is Senator Kelly Ayotte. She is a former attorney general for her state. She is a leader on these issues. She's a major champion of the Comprehensive Addiction and Recovery Act, and a great supporter and leader, and understands the importance of addressing these issues at the local level. So please, Senator, come up.
Well, thank you, General. I'm so glad to be here with all of you today. And I think the takeaway, as I was listening, I think it was Dr. Wolfson talked to you about all of this, is the takeaway is that we can make a difference, and that we better make a difference. Because, you know, my state, having been an attorney general, having seen the effects of substance abuse on so many families, but the reality is, having worked on these issues at the state level with local law enforcement, emergency responders, what has really drawn me to this in Washington, along with the other senators that you've heard from, those of us like Senators Whitehouse, Portman, Klobuchar, that are focusing on the Comprehensive Recovery Act, or CARA. What's brought me this is that the number of my constituents who are coming to me with stories, and some of you may have heard me talk about these stories before, but you know, I have one family who's really given me permission to talk about what they've gone through in losing their daughter Courtney, and Doug and Pam Griffin from Newton, New Hampshire, from a family that any one of us could be in, an average family, a loving family, a bright young woman whose future was cut short by her addiction to heroin. And what we're seeing in New Hampshire, like I think so many states in this in this country, is that substance abuse, and right now heroin, is killing people, and it's killing our constituents. This is a huge public health epidemic, and it's an epidemic that none of us can afford to ignore. And it's one that, having been the chief law enforcement officer of our state, I've heard from our police, we cannot arrest our way out of this. It's not that we can't do things to go after the people that are trying to make the money off of it. Absolutely, we can do that. But if we don't have treatment, we don't have prevention, we don't have public health understanding, and we don't have everyone working together from both the law enforcement side, the treatment, the prevention, the public health officials, the schools, the libraries, the families, the understanding, then we are not going to solve this problem. And so that's why I've been, you know, proud to be part of this CARA effort, and I'm hoping that we can move this legislation, the Comprehensive Recovery Act, because it does focus on expanding prevention efforts and education efforts, and the lessons you've learned, we're going to need to apply them. I saw what you did on tobacco, and I'm convinced we can do that on heroin. And, you know, I've been standing with my first responders, sponsoring a number of pieces of legislation when it comes to naloxone or Narcan, and I'm happy to support them in that effort, but what I want to be in is a position where we don't have to administer Narcan, where we don't have to bring people back from the dead. And the fact that it impacts so many families, I went on a ride-along with our fire department this summer, and sure enough, couple of hours into the ride-on, I get called to a heroin overdose. And you know what? In that room, there was a young man who was close to death. He was brought back to life with Narcan by the emergency responders. But what really struck me in that room is that there was a baby in the crib in the corner, and the firefighter handing the baby to a young mother. And so this is a family issue, and we're going to have a whole generation of people who don't have the strength and support in families, by the way, from all walks of life, if we don't get this right. So I know that others have talked to you about what the legislation does. I just want you to know that I'm going to push as hard as I can to put this on the top of our priority list, because not a Republican issue, not a Democrat issue, not an independent issue, not whatever your party you want to call yourself. This is an issue that hits everyone and every family, and if we don't do something about it when we have an opportunity to do it, we're going to lose more people in this country. So I want to thank all of you for your efforts every day. I also want to mention another partner in this, Joe Donnelly from Indiana. He and I have introduced a separate piece of legislation that's focused on heroin and prescription opioid abuse prevention. And some of those efforts are also mirrored in the CARA efforts. But one of the things that I've been struck by in, unfortunately, talking to our chief medical examiner is the relationship between prescription drug abuse and the transition that many people are making with the low cost of heroin. And so we've got to get at it at both angles. And so our act really focuses on strengthening the work that we've been doing on prescription monitoring, on also a public education campaign so that people understand that it's not so innocent when you're abusing prescription drugs and what that can bring you down the road in terms of the impact on your life and public health. And then I want to mention the criminal justice piece, because I think I was as tough a prosecutor as anyone. But I also know that we have a revolving door. And part of the problem with our revolving door is substance abuse, because people go in and they commit crimes because they're addicted. And then guess what? In prison, they often don't have the treatment. They never dealt with the underlying issues. Even if they're kept clean there, those underlying issues are still there. And so I've been proud to support the reauthorization of the Second Chance Act because if you're going to send someone out of prison without the structures there, without having gotten any treatment, without the opportunity for a job, then you can predict what's going to happen again. And it's not good for our society, and it's obviously not good for the individual's ability to be productive in this society. So I think that's something that has to be part of this discussion as well. And then I wanted to mention one final piece that I think is so important, and that's mental health in all of this. Because as we know, there's so much co-occurrence, and that treating our mental health really can drive some of these substance abuse issues. And this is an issue that I'm proud to be also a co-sponsor of the Justice and Mental Health Collaboration Act. And so these are many of the issues I work on have been focused on improving our mental health system, and I think that has to work hand in hand with all the efforts that you're undertaking, and hopefully we can get past to help your efforts on the recovery, the prevention, the treatment, all the things that you're doing every single day. And I'm convinced that we can make a big impact on this. And if we don't, shame on all of us, because unfortunately, I think all of us, even if in my professional life I know people who have come to me and told me their stories, but in my personal life, I think all of us in our personal life know friends or family or someone that we're close to that's been impacted by this. And so I think that this is incredibly important. I just want to thank you for your efforts, and I look forward to continuing to work with all of you and my colleagues so that we can give you more tools to work with, because you're really on the front lines and you just need our help to do the work that you've studied, that you have the research on, and that you know what is the best solution in your communities to address this public health epidemic. So thank you for all your work. Appreciate it.